Hi, pleasure to be here. Really amazed by this event organized and really leaves me very optimistic. Also, pleasure to be here and share my geeky passion for data-driven innovation. And I would like to set the ground for our upcoming discussion and describe how we can pragmatically expedite in a scientifically solid manner new treatment approvals and their integration. So for me, PTSD treatment approval urgency is a subject close to home and as a topic I'm very active in. I'm a product of a startup nation, so Israeli, my academic and professional background are in emergency medicine. I also was a paramedic and a captain in the medical corps in the IDF. My health research spans from epidemiology to public health, everything around medical data and informatics. And for the past 17 years, I've been combining these skills as a serial entrepreneur. And I've been employing AI tools to specialize in health sciences. And that is also my disclaimer. I'm the founder of several data analytics startups, companies. And one of them is Enlight Exchange, who specializes in mental health data. So this is a multidisciplinary crowd. And I would say with high confidence that we all share that common goal: healthy people, healthy citizens. And I think we share the urgency to have our citizens healthier, and we can be successful by addressing the most human-centric health challenge, which is mental health. Mental health is the most patient-centric medical domain. Having mental health condition is debilitating. It's turning our patient into non-functioning citizens. So for having a mental health condition, it sends ripples beyond the healthcare system. And that's what health sustainability is all about. Support healthy, I'm quoting, support healthy, equitable, and resilient environment and communities over time. That's the goal of health sustainability. So when we address sustainability in healthcare, we understand that there are many factors influencing an individual health, regardless age, race, ethnicity. We refer to these factors as social determinants of health. And this infographic on the left is demonstrating the contributing factors of how multidisciplinary policy is shaping and should be shaped in a way to make an impact. So this is the way. These factors that you see here are quantifiable, measurable, and that is where what we do when we analyze, when we practice and analyze data-driven, and we're doing data-driven health science. The principle that guides us is what we call evidence-based medicine. This core decision-making way is the way that we process and making decisions across healthcare, life sciences, regulation, and policy making. The principle is manifested today, this evidence-based medicine principle is manifested today by data-driven evidence, as we have so many digital health assets that are capturing all these data points. So you see here 4 pillars. This is what we call the quadruple aim in healthcare. And these 4 pillars outline all the core objectives that we research in health science: the health outcomes, the safety, the efficacy, the cost, the pricing, as well as the burden and the quality of life of our patient, but also of their providers. So how do we assess all these measurements? Data. The majority of the collected data and recordings that we have in real-life setting is data that we collect at the point of care, so electronic healthcare records, and from patients, whether they're reporting actively or reporting passively at home, at their daily life and activity. So this is called real-world data. Real-world data comes from multiple sources, as you can see here. And I would say that in mental health, in recent years, there's been an explosion of mental health applications that generates a lot of data. And for example, patient mobile apps that are able to passively read my behavior, how I use, how long I sleep, how much I use my phone, do I walk, do I run, activity, lifestyle activity, and at the same time solicitate me, asking me for feedback as a user about how I feel, or if I just went through a treatment or a ketamine session, and I get a questionnaire to fill in. That all happens in one app today, and the beauty is that now these apps are also connected to the psychiatrist clinics, to the electronic healthcare records, or the ketamine clinic that was treating me. So a lot of advancement around health data. So I feel like the mental health domain is only now closing that digital innovation gap, which enable us to tap into a lot of data. But healthcare is also siloed. So we have a lot of data islands running around and not connected and not properly being used. So I think that said, the status today is really offering us precious opportunity to accelerate mental health innovation and to do that data-driven, but in an effective way, in a better way, and close that evidence gap, innovation gap. But there is innovation, as I mentioned earlier. A lot of startups are focusing and invested in mental health care. So a lot of data points that we can do this whole data-driven innovation. That said, great, a lot of data, but then data islands, and part of this whole data-driven challenge that we have today is very fundamental, I have to say. It's just making the data more fair. And fair stands for the data being findable, just to know where it is, where all the apps are, where all the health electronic records that are research-ready, the research data, open access data, in that specific field that I'm looking for. So data need to be first findable, and then accessible. And later on, we can get more technical and make it interoperable, so really connecting and harmonizing it. And then later on, doing this one-time effort, make it reusable, so we can research it again and again and over time. So we have health qualities that we need to align to. I won't go through them. This is an illustration of here, so health economics on the left, outcome research on the right. And this busy slide is really to give you the breadth of how much information and measurements that relates to health and the economics of health and the care and medication approval, novel treatment approval, is hidden in that data and can be reused. So coming back to the reusable part, so once we have all this data available, connected in a high-quality manner, we can then start reusing it, whether I'm a health economist or I'm more on the regulatory side, and I'm looking to do real-world data studies. This is briefly to show you how a classic drug life cycle looks like, and the need for data points across a drug life cycle. So the blue part is what's happening in the pharma company, in the R&D phase. But then comes the launch part, where this drug that been tested on, say, 1,000, maybe 10,000 of people, is meeting the public, is meeting the real world, and that's where we need to collect more and more data points. And I think this is to show that mental health is different. We are doing this, and you've seen all of these beautiful studies that colleagues have been presenting today, but that really doesn't cover what's happening in mental health, and that's the real life. And this is what we're trying to bridge here, and this, in my view, requires also a different data strategy. So this is the data strategy that I'm talking about. The evidence strategy, especially in these present times, we have to be pragmatic. And we have to dedicate, and we have dedicated science to being pragmatic. It's called pragmatic research. And to do pragmatic research, which is basically real-world research, we need the data, and we need a good quality of data, and we need to rethink across the stakeholders, so regulatory and health authorities to approve, but also to accept the pragmatic research that we're able to present. So I think my take is that in mental health, when we focus on pragmatic research and pragmatic clinical trials, we're able to bridge the gap between research and delivery of care, which we need so much. I would say otherwise, pragmatic research is jet fueling decision-making in a timely manner. And I think in this PTSD pandemic we're suffering from, or mental health pandemic, the timing is now. So it's about to be, we should be pragmatic rather than too academic about it. So we cannot ignore the promise that psychedelic-assisted therapy has offered. We have to think out of the box and rethink the evidence strategy to be more translational than traditional. We cannot afford not to be pragmatic. So I think I'm leaving this stage where I'm today much more optimistic, especially after listening to all of you today. I think we're heading in the right direction, and I think there are many agents of change here in the room. And like this beautiful orchestra, we just need to get together and do our part to really drive this mental health innovation and accelerate. That's it. That's my piece. Thank you.